This is our modified bus by Ella.
And Molly.
So this is our bus. This is our layout of the bus. We have all of our equipment and medicine in there, and staff.
Yes.
And our goal is to be prepared and to be able to respond to any emergency and patients for any emergency.
Yes. Our plan for staffing is to have a bus driver, a paramedics, disaster response technician, emergency medical technician, and emergency response physician.
Our plan for equipment and supplies is to have a stretcher, AED, gauze, backboard, IV stands, fridge/storage and cabinets and whatnot, wrap, eye drops, tourniquets, and a speculum.
For medication, we will have morphine, which we will use to relieve severe pain fast. We will have epinephrine, which is used to open airways and narrows the blood vessels and raises blood pressure. We will have IV saline, which rapidly rehydrates the body, which needs to be kept cold. Albuterol, which is medication to help breathing by relaxing muscles and airways, which also needs to be kept cold. Glucagon, which increases blood sugar levels. Narcan, which quickly reverses opioid overdose. Aspirin, which is a pain reliever, reduces fevers, anti-inflammatory, and is a blood thinner. And oxygen, which increases the amount of oxygen per breath. And atropine, which counteracts many poisonings and medical emergencies.
And okay, so we have scenario 3, which is a building under construction collapses in a major urban area during a rush hour.
Yes. What will our team do to help? Well, our bus driver will get us to the construction site and back to the hospital. The paramedic will be in the bus assessing and treating patients. Our disaster response technician will be assessing the scene and conducting the post-disaster response. The emergency medical technician will be caring for patients in the bus and on scene with different equipment. And the emergency response physician will make immediate medical decisions and may direct our medical staff.
Okay, patient 1 is triage patient 4. Their symptoms are having trouble breathing and dust in their eyes, so what we will do for her is give her an oxygen or a bureau, depending on how well she can breathe on her own. We'll put her on a stretcher because she's having trouble seeing and breathing, so we don't want her falling over or hitting something, and then we'll use a speculum to flush her eyes out.
Yes.
Or the dust in her eyes out.
Yes. Next we have patient number 2, which is triage patient 3, who is unconscious but breathing and bleeding from the back of the head. For them we will use aspirin or morphine depending on the pain level, a stretcher because they're unconscious and we don't want them to be flopping all over the place, and gauze to control the bleeding.
Okay, and then our next patient is patient number 3, which is triage patient 1. They have a severe headache, stiff neck, and nausea, so we'll give them aspirin or morphine depending on the pain level, and we'll probably just put them on a stretcher and or a backboard depending on how bad the severe stiff neck is.
And next we have patient number 4, which is triage patient 2. He has a sore arm after a collision on his bike, so we'll give him aspirin or morphine depending on the pain level and put him on a stretcher, and then let a paramedic follow up later for an x-ray.